How are you doing there? Right. Done really, really well. Are you still a bit groggy? I tell you what, I'm going to come and sit with you for a minute. Yes, I am. And we're going to go through a few things. The nurses have told me you're doing ever so well. Just bring myself in. These sweets are really quite lovely, aren't they? Now, are you all right there? Good. Genuinely, these private suites are something else, aren't they? You were very lucky to end up getting seen here. So many are on the waiting list. For such a long time, you know. Now, have you managed to pass urine yet? Good. Well, that's excellent news. Excellent. Excellent news. I'm very pleased to hear that. And have you managed to keep down any food? Anything at all? Right. Well, sometimes that's a little more difficult. Plus, it's not always the nicest food here either. Don't worry. Soon enough you'll be ordering in all the takeaways. Now, before I do some of my checks, I'm just going to have a quick look through here. Now, have any of the other specialists spoken to you about side effects? A little bit. Well, I'll just run you through it a bit more. First question I need to ask you, on a scale of perhaps 1 to 10, where's your pain sitting at the moment? No, the scale is 1 to 10, 1 being 0 pain, 10 being excruciating. I hope it's not excruciating. Around a 5. Okay, that's to be expected. It's still very early days. You have had your entire abdomen opened. That's going to take some work, some repair. But don't worry, we're right here with you the whole time, alright? Okay, I'm just going to run through with you a few of the side effects or perhaps things that can happen after surgery. Obviously, we do our very best to ensure that there's no chance of infection, but infection can arise sometimes. Sorry, I'm talking of infection. I'm just going to double clean my hands with you. Infection can obviously arise, but we do our very best here to ensure that the chances of that are completely limited. That's right. And have you experienced in the last 3 hours any sharpening pain or increasing pain particularly? No, good. Well, that's good to know, right? That's really good. I'm going to check the wound in a moment just to see if there's any swelling or excess bleeding. These things can happen after an operation, and obviously we'll be doing our best to ensure that they don't, but occasionally, unfortunately, they do. And the best thing to do is to catch that early. So if you don't mind, I am going to come in and take a little look at that wound. Alright? Alright. Just stay there. Get you to just lay your head back a little. So just lay your head back. You don't need to look at me, you can just look up at the ceiling if you don't want to have a look at what's happening here. I'm just going to very gently, there we are, just move that aside. Just need to get under the gauze. That's it. Right. I'm just going to bring in a light. You could just continue to stay there. You're just going to feel quite a warm light running over you. I just just want to really take a look, very in-depth look in there, and check there's no nasties going on. No, I think you'll be alright there. I'm just going to bring the light round this side. Has everyone been treating you well? Your recovery is going to be excellent. You had the very best surgeons, you know. Did you know that? Right, just going to run that across. I think we're going to be alright. I'm going to just check in on the other side again. That's it. Okay, I'm going to just press a few pressure points. And I'm going to ask you to tell me from 1 to 10 again how severe the pain is when I work in those areas. So I'm coming into the top here. Just a very gentle press. How's that? Alright. I'm going to come down the sides. You'll just feel me down the side of your body. How's that? A little bit more pressure. Alright. Bringing it into the left hand side. Oh, okay. Alright. Just take a breath for me. That's it. You're fine. I just really need to ensure that everything is completely seen. Now I'm just going to bring a tool in, but don't be alarmed. It's literally just to check some of those stitches. There we are. Just going down the middle, look, just teasing that aside. Right, more than happy with that. So, I think we'll be fine. I'll just put that away. How are you feeling still? Are you alright? Good. Alright, just bring that cover back down again. Alright, let me just run through a few more details with you. Now, have we spoke about what recovery is going to look like for you? No. Okay. Well. Now, I'm going to just go through with you exactly what is going to happen over the course of your recovery. You're looking so sleepy. Just close your eyes and listen to my voice. That's it. Just close your eyes. There you are. Now, let's see if I can't just put your mind at rest as to what your recovery is going to look like. So, you'll be spending your first week here with us. You needn't worry. All the staff are simply the best and are going to take the very best of care of you. I myself will be dropping in each morning to check on you. Are you still feeling okay? I'll take your temperature in a moment. Good. Now, when you leave the hospital in a week's time, all being well, I'm going to send you home with a myriad of medication. But please don't worry. Everything I'm sending you home with, you will be able to also access from the local pharmacy. So there's no fear that you'll run out of anything. And hopefully, by the time I'm sending you home, you'll only be on the lowest level of medication. That being said, in the meantime, you have a morphine drip right next to you and a button. Now, I don't expect you to be holding back for the first couple of days. Actually, it's super important to not put your body under any stress. And so,
the best thing you can do is when you have those moments where you feel the pain level has just increased beyond what you can manage. You don't need to call the nurse, just press that button once. That's it. And that will just give you a dose to take the edge off and keep your body in that perfect calm state, which is exactly what we're looking for here. Now, once you're home, you are looking at least another 6 to 8 weeks recovery. Yes, I've already done you a medical note that will be signing you off for the following 8 weeks. I know you were hoping to get back to work a little sooner than that, but what is the most important thing here? It's you. You are the most important thing here. The only thing that matters. So, during that time, let's talk about what recovery is going to look like for you. Now, as you've had your entire abdomen opened, all of those layers of muscle have unfortunately been sliced through. This means it's going to take a relatively long time for those to knit back together solid. So unfortunately, with the job you do, that's not possible for you to sit around and relax, is it? So, please don't worry, but no driving for the first 6 weeks, no lifting anything heavy at all, and definitely no going back to the gym until you've passed your 8-week checkup. Is that very clear? I see you wincing, even with your eyes resting. Good. No, I am perfectly certain that in time you will return to exactly as you were. Your strength will come back, but I do have to be realistic and honest with you. A lot of patients do feel that sometimes 6 months, even up to a year after this kind of open surgery, they can still feel a very tight, tingling sensation, sort of itching inside the scar, and that's perfectly healthy. Actually, that's what we would be looking for. If it's very numb and we have no sensation, that would actually cause me more worry. So, I don't want you to worry when you get those tingling phantom feelings, alright? Of course I can arrange for you to have a pizza tomorrow. The food's a bit hit or miss, I'm afraid. They have great staff in the kitchen, but I think it really depends on whose menu's on that week. You really did do very well to get in here. I do want to just take a look again at that area. Will you let me know? Remember the scale was 0 to 10, 0 being no pain at all, and 10 being excruciating. If you could, just let me know when I touch these areas again. If there's any areas that are really sore. How's that? Okay. And what about here, down the sides of your body? I'm going to run my finger just a little bit. That's it. Do you feel that? Alright. And on the other side. I'm awfully sorry we've had to poke and prod you this way. I tell you what, I'm going to get you to simply rest your eyes now. You can just listen to me and my gloves just messing around, doing all the little intricate checks that need to be done. I'd like for you to just rest now. Alright, just rest. Close your eyes. Take a little shot of that morphine and just let yourself just sink back into the mattress. Going to help you rest tonight, and in the morning the nurse is going to come in and help you stand up and move around the room. Alright, your rehabilitation starts first thing in the morning, but tonight you can just rest. Sorry if that pinches your skin slightly. That's it. You can